moving on to the next presentation, Prevalence and Associated Factors of Malnutrition in Elderly Patients at Outpatient Clinic, Community Hospital, Central of Thailand, a hospital-based survey using multinomial logistic regression model cross-sectional study from Ms. Yanisa Praneetvatakul.
Good morning, judges and attendees. First of all, let me introduce myself. My name is Yanisa Praneetvatakul, and I'm from Phramongkutklao College of Medicine. I'm here today to presenting our research, Prevalence and Associated Factors of Malnutrition in Elderly Patients, a hospital-based survey central of Thailand. Similar to other developing countries, Thailand is now dealing with the rapid growth population of elders. People aged 60 years and over are expected to be the main population very soon. So, factors affecting the main population health shall be focused on. Speaking of health factors, nutritional status is one of the most important factors for the elders. Malnutrition results in decreasing quality of life and mortality rates. However, malnutrition could be prevented and dealt with if detected early. Hence, this study is conducted using M&A questionnaire or mini nutritional assessments. A screening tool for malnutrition in elderly proved valid according to former Thai and international research. This study aimed for two objectives. First, to study the prevalence of malnutrition in the elderly patients. Second, to study associated factors. Inclusion criteria consists of patients who age 60 years and over. Meanwhile, patients who had impairment were excluded. The study was designed as a cross-sectional study. Primary and secondary data were collected and statistically analyzed with SPSS. Association among the factors were determined using binary and multinomial logistic regression. For the results, participants were divided into three groups following M&A. As shown, 4.4% were malnourished, correlates prevalent from former study which was 6.1%. 18.7% were at risk of malnutrition. However, total sum of the in need of intervention groups would be 23.1%. Since these two both need intervention as soon as possible in order to prevent the growth of malnutrition prevalence. Our participants were mostly female, which were 60% of total participants. While focusing only on malnutrition groups, all 4 malnourished patients were female. This table shows demographic characteristics of participants. Approximately 20% were categorized as low income. Around 90% were living with their families and consume homemade food, and only 33% didn't exercise regularly. Focusing on malnutrition group, 3 patients had low income, and 3 patients didn't exercise. These are some of participants' characteristics. The study revealed association between COVID-19 infection and malnutrition. Surprisingly, half of the malnutrition group had history of COVID-19 infection. Meanwhile, 50% of in need of intervention group also had history of COVID-19 infection. Using multinomial logistic regression, regarding the adjusted odds ratios, we found that exercise were protective factors of both malnutrition and at risk of malnutrition. Meanwhile, gouty arthritis and cancer are risk factors for malnutrition and at risk of malnutrition. We also found that history of COVID-19 infection was the risk factor for malnutrition. A positive association of gout and malnutrition could be explained by a relationship of serum albumin reflecting on nutritional status. The lower serum albumin, the likelihood of the gout increases. Cancer-positive association with malnutrition found in this study could be resulted from multifactorial, which were disease symptom itself or the side effect from the treatment. Therefore, elder cancer patients may need more close attention on nutritional status. Consulting nutritionist is recommended. To discuss a negative association of exercise and malnutrition, during exercise, adaptive processes occurred, resulting in total and peripheral nitrogen storage, which leads to promotion of muscle anabolism in elderly. Regular exercise, especially resistance training program, promotes muscle anabolism and protein metabolism. So we assume that encouraging exercise program for elderly could benefit in preventing malnutrition. Discussing the relationship between history of COVID-19 infection and malnutrition. There are three main points to be explained. First, the virus enters host body through a receptor called angiotensin-converting enzyme 2, found primarily in the lung and GI tract. The large amount of these receptors presenting in GI tract make the system one of the main targets of SARS-CoV-2 attack. So other than respiratory symptoms, elderly with COVID-19 infection patients also have serious digestive tract symptoms. Second, COVID-19 infection causes synthesis of acute phase protein in acute inflammatory response. This acute phase protein synthesis requires the consumption of albumin and muscle protein. Lastly, COVID-19 infection causes symptoms such as anxiety and loss of appetite, which could later result in malnutrition. In conclusion, the study revealed that the prevalence of patients in need of intervention is 23.1%. Associated factors of malnutrition are history of COVID-19 infections and exercise. At risk of malnutrition, associated factors are cancer, gouty arthritis, and exercise. Please keep in mind that this is a cross-sectional study, so time-cost relationship could not be clarified, which made this association unclear. We suggest further research to be designed as a cohort study in order to clarify incidence and risk of malnutrition. They also need larger sample size and longer duration of data collection to identify associated factors. Thank you for your attention.
So now we will proceed to question and answer session. Can I have a question from judges, please?
Sorry ครับน้องยานิสาครับ what is the definition of the malnutrition and at risk of malnutrition again? The definition used in your research.
In the malnutrition and at risk of malnutrition, it is the outcome we collected by the using mini nutritional assessment, the questionnaire that using for screening malnutrition that have proved to be validity through the many research.
Okay. The point is that you have to standardize the definition throughout your research. Okay. You should discuss this point in your publication. And another point is that since this is a cross-sectional study, so be cautious of interpreting the causal relationship between something and another, because it is also possible that the patient have malnutrition and then they are at risk of COVID-19 or they are unable to exercise. Don't think as only one way. Do you understand me?
Yes.
We can conclude the causal relationship from the cross-sectional study, because we don't know which occur first. You just I recommend that you should use the word associate with A, associate with B, not A and then B. Beware of that.
Okay.
Thank you.
Thank you for your recommend.
Are there any more questions? If there are no any questions, so thank you for your presentations.